Hello. Um, Today we are going to talk about instrument identification of instruments, and so we are going to start with the few ones we have here. Number one, we have dissecting forceps. This is a dissecting forceps. So this is a tweeted dissecting forceps and non-tweeted dissecting forceps. So we can equally use it for dressing, picking up swabs. We can also use it for picking of grafting the edges of wood in suturing, not only for wound dressing, but also use it for suturing. So this is a dissecting forceps, both two-third and non-two-third dissecting forceps. So we also have what we call here blade holder. So this blade holder is being used for making an incision during a surgery. So here we attach a surgical blade to it to make an incision during what surgery. You can equally use it to shave a patient. So here this one is what we call the scissors. So this is a scissors we can use for cutting during wound dressing. You can use it to cut plasters. You can use it to cut the gauze or even the bandage. So you can probably use it for that. So this is a shuttle forceps. So this shuttle forceps is for picking swabs from the drum. You can use it to pick swabs or cutting from the drum. So you can probably use it to pick some instruments. So that is what for the shuttle forceps. So we have Pinner's fetoscope. So Pinner fetoscope is used to examine, to check the fetal heart of a fetus inside the uterus. So we use it to check the fetal heart, checking it for about 1 minute. Checking it for about 1 minute. So the work of this fetoscope or Pinner fetal stethoscope is to check the fetal heart rate of a baby inside the womb, inside the uterus. So we have here the uterine sound or hysterometer. So this uterine sound is used to check the depth of the uterus. So we use it to check the depth of the uterus by injecting a sound through the uterus. So with this, you should be able to know where the uterus stops. So that's for uterine sound. So here we have what we call Harrison forceps, thoracic forceps. Here we use it to pick instruments.